Good morning, Sarah. Can I have the patient handoff report for Ms. Carter?
Sure. Mrs. Carter is a 65-year-old African-American female who came in last night complaining of chest pain when she was gardening. She reported that her chest pain did not go away when she was relaxing, with additional symptoms of diaphoresis and restlessness. She mentioned that recently she had been stressed out with work. She is ANO times 4. Her past medical history includes diabetes type 1 and hypertension. She is allergic to penicillin and is currently taking insulin lispro, sliding scale, and metoprolol. Her vital signs this early morning was a heart rate of 65 beats per minute, respiratory of 15, blood pressure of 135 over 80, O2 of 95. She received an echocardiogram last night that showed angina through changes in ST segment and T wave segments, as well as a blood test that showed elevated troponin of 3 of 3. Yeah. The provider ordered nitroglycerin tablets for her to begin, and her husband is at the bedside. So I would say continue to educate her of how to take nitroglycerin at home, educate her of what she can do to decrease another occurrence of an angina episode, monitor her echocardiogram for any abnormal changes, and assess her vital signs every 4 hours.
Okay, great. Thank you.
Of course.
Can I come in?
Yes.
Good morning. My name's Amanda. I'm going to be your nurse today. Do you mind if I verify your name and date of birth?
My name is Julia Carter. I was born 02/16/1959.
Great. I was just speaking to the night nurse, Sarah. She told me that you came in last night suffering from some pretty bad chest pain. Is that correct?
Yes, I was in the garden working and I thought I was overworking myself when I all of a sudden got chest pain. And I went to go relax, but I still had it. The pain was so bad I thought I was having a heart attack, so I told my husband to take me to the hospital.
Oh my goodness, that must have been pretty scary. Have you ever had any chest pain like that before? And how would you rate that chest pain?
No, I've never experienced anything like that before. My pain was like a 9 out of 10. Nurse Sarah said I'm suffering from something called angina and will be put on a medication called nitroglycerin, but I'm not really sure what that is.
Okay, I can help you understand that a little bit better. So angina is chest pain caused by when the heart doesn't get enough blood and oxygen. Your provider ordered that nitroglycerin to help alleviate that pain by relaxing those blood vessels. So when those blood vessels are relaxed, you're allowing more blood, more oxygen to reach your heart. So before starting this medication, I do have to ask, do you have any cultural, religious, obligations or any reasons that you wouldn't like to take this medication?
No, I can take this medication, but when do I take it and how often do I do it?
Okay, that's a great question. So you should use nitroglycerin wherever you begin to feel that chest pain. So as soon as you feel it begin, you should sit down, make sure you're in a comfortable seat, not standing, and place the tablet underneath your tongue with no water. Once the tablet dissolves, you'll feel a slight fizzing sensation, which is normal. You need to let it fully absorb underneath your tongue. So you're only allowed to take that tablet 3 times within 15 minutes. That's really important to remember. So if you take 1 tablet, wait 5 minutes to see if your chest pain improves, and if it doesn't improve, you're going to take another tablet. You can only take a maximum of 3 tablets in that one sitting, that 15-minute time period. If you take your 3rd tablet and feel no relief and still have that bad chest pain, you need to call the ambulance.
Okay, so I can only take up to 3 pills within 15 minutes of each other, and if I have my 3rd pill and I still feel pain, I have to call 911?
Yes, that's true. You should feel relief from the tablet, usually 1 tablet within 5 minutes. If you don't feel any better, especially by that 3rd tablet, you need to call 911. Mr. Carter, you also need to be aware of your wife's chest pain. So if it doesn't alleviate within those 3 tablets, you know when to call 911.
Okay, I understand. So she should take 3 tablets, and if she still has chest pain, I should call the ambulance.
Yes.
How do I store this medication?
Okay, so it's pretty simple. You're just going to store it in its original bottle in a cool and dry place that's away from the reach of any children.
Okay, and are there any adverse reactions or side effects to this medication?
That's a great question. So there is some chance of side effects. So with this medication, you could experience dizziness, a little bit of flushing, so you'll have that redness in your face, headaches possibly. So if this dizziness occurs, you want to make sure you're seated when taking this medication so you don't have any risk of falls. Additionally, you want to change positions slowly so you can decrease that dizziness. If you develop a headache, try to lie down in a cool, relaxing environment. And these should typically resolve on their own. If not, you definitely should speak to your doctor if these don't resolve. In addition, with this medication, there's always the risk of severe side effects, including allergic reaction. Some signs to look for would be hives, swelling of the face, lips, and tongue. If you also experience those, along with more frequent chest pain or angina attacks, you need to seek medical help immediately.
Medication alternatives is there to this drug?
So when it comes to like other alternatives to nitroglycerin in that one form, nitroglycerin comes transdermally in a patch, sublingual in a spray, topical in an ointment, and transmucosal. You said alternatives. So you are going to be taking this nitroglycerin, but if you're wondering about some other things you can do to prevent angina, I'd be happy to share that with you.
Yes, could you explain?
One thing that could help, if you guys smoke, I would promote smoking cessation, maybe switch to nicotine gum or a nicotine patch. That'll reduce your incidence of that chest pain. I also recommend exercising. So a little light exercise, a little walking, maybe yoga would be beneficial. And monitoring your diet, you definitely want to cut down on any foods that are salty, high in fat, and are fried. And lastly, I'd recommend just knowing your triggers. If certain things like climbing up the stairwell really triggers your chest pain, or maybe intense exercise trigger your chest pain, try to avoid that. So that was a really good question.
Thank you so much. I think I'm going to stick to the sublingual medication. I just put it on my under my tongue and wait for it to dissolve, right?
Yes, that's what you do. Before I begin your discharge, I want to provide you with some sources to read up about angina, and for you and your husband as well.
Thank you.
There are 2 local and 2 national ones. The local one talks about how to decrease your risk of cardiovascular disease. It's from Mount Sinai. The second one talks about the use of nitroglycerin, and it's from Columbia Doctors. Other sources I want to provide you with are national sources that discuss angina and the different types. And the other article is about nitroglycerin and the different routes it can be taken. So basically all these sources are going to give you a little bit more information regarding your medical condition, what you can do to kind of prevent angina, and how to properly store and use your medication so it works effectively for you. I'm going to get these papers for you.
Thank you.
Both the local and national resources are right on here.
Just one more question. If I say this medication isn't for me, do I just call my provider?
What do you mean not for me?
Like if I think it's not working well, or
If it's not working or responding to your chest pain, especially if you're feeling that severe chest pain, you've taken 3 tablets, you absolutely need to talk to your provider and possibly even go to the hospital.
Okay.
You should stay in contact with your provider, especially when starting a new medication. So if anything goes off, something doesn't feel right, you should definitely reach out to them.
okay, thank you.
Okay, so
You're welcome.
let's just.
Do you have any other questions?
No, I think I'm okay.
Okay, thank you so much.
Thank you.